Christina Martin, and I'm here to do my complete head-to-toe physical assessment. To begin with, I had my patient to empty his bladder and put on a hospital gown, and also I have measured his vital signs. I've checked his temperature, which is 37.0, his pulse, which was 79, his respirations, which was 16, and his blood pressure was 130/70. He sat 98% on room air, and his height is 5'9", and his weight is 265. So I've got all of those things complete, and then I'm going to use a Snellen eye chart. Now, to use a Snellen eye chart properly, I know that I would stand approximately 20 feet away from the patient to get an accurate measurement, but for video's purposes, I'll just demonstrate the correct way right here where I can stay in the video. So I will have the patient to cover their right eye with their hand and read. We'll start off with the 20/20 line.
Line 8.
Mm-hmm.
D-E-F-P-O-T-E-C.
Okay, and then cover the other eye. And line 8.
D-E-F-P-O-T-E-C.
Obviously, that would be accurate if I were 20 feet back, but that is how I would use a Snellen eye chart on the patient. Next, I'm going to come to the patient's head, and I'm going to inspect their face. I'm going to inspect their head and their skull. I'm going to inspect for symmetry of the eyes, the nose, the mouth, and the ears. I'm going to inspect the external ears and make sure that there are no lesions, bumps, abnormalities noted on the ears. I'm looking at the eyes. While I have him here, I'm going to whisper something to him, check his hearing, and have him whisper back. Okay, and so he said 99, so he can hear. And also, I'm going to just rub my fingers together and ask if he can hear those simple sounds. You hear that? And I would do that bilaterally. Okay, so while I'm doing that, I'm going to go ahead and continue testing his neuromuscles of his face while he's here. So I'm going to have him to wrinkle his forehead, this, round. Okay, puff up your cheeks. Close your eyes and open them. Squeeze them tight. Okay, squeeze your teeth. Stick out your tongue. Say ah.
Ah.
Okay, and while we're doing that, I'm going to go ahead and I'm going to look at his scalp for any kind of lesions, bumps. Also looking for any kind of infestation that may be noted on the scalp. I'm making sure that he is normocephalic, which he is. All bones are intact. There's no infestations. His hair is clean and dry and dispersed evenly throughout. Also, during that time, I'm going to palpate the scalp, looking for the exact same thing. I'm looking for any kind of abnormalities, making sure that there's no softer areas or areas that have heat to it, areas of inflammation, anything like that. I'm going to go ahead and palpate the pinna, and then I'm going to palpate the sinuses. Okay, and then I'm going to have him open and close, testing his temporomandibular joint. I'm listening for popping and making sure that there is no TMJ there. And were there any tenderness in your sinuses? Okay. After that, I'm going to go ahead and look at his eyes while we're here. And I'm going to use the light for sensation. With the light sensation, I'm also going to test his forehead, cheeks, and chin for the light sensation. Okay, and with that, I'm going to check his pupillary responses. I'm going to make sure that both pupils are equally round and reactive to light accommodation. So I'm going to get you to look straight ahead, and then look back at my finger, and then look straight ahead, and then one more time. Making sure that his pupils accommodate to light at different lengths. And then I'm going to shine the light in his eyes. I'm going to ask him to look straight ahead. And I'm going to make sure that his pupils constrict. appropriately to light, which they do. While I'm standing here, I'm going to look at his nares, and I'm going to check for patency bilaterally of both nares. And I'm going to say, can you inhale? Okay, inhale. Perfect. I am going to also continue to look at his eyes, and I'm going to look at the sclera, make sure there's no jaundice, no drainage, or anything like that. I'm going to look in both of them. I'm going to look at the mucosa, making the conjunctiva, making sure that it's pink and moist and doesn't have any signs and symptoms of infection. I've already done his eye screening using the Snellen eye chart, and that's within normal limits. Okay, I'm going to go ahead and look inside the ears with just my pen light initially. Again, I'm looking for any kind of drainage or abnormality. Okay, and I'm going to go ahead and have him to open up his mouth, stick out his tongue. I am assessing the uvula, the hard palate, the soft palate, the tongue, the teeth, say ah, and I'm going to look underneath. I'm going to look at the buccal mucosa on each side, and I'm noting things like dental caries or absent teeth or any kind of lesions or nodules noted in the mouth. Looking through all of those, making sure that there are no abnormalities noted in the mouth. Okay, I am going to go ahead and I'm going to test his hearing while I'm here still on his face, and I'm gonna, oops, let me hit it one more time. Let me hit it on this. And you tell me when you stop hearing it. Okay. I'll do behind both ears now. Still here?
Mm-hmm. Okay.
He's got some good hearing. Okay, I am going to go ahead and continue my exam, and I'm going to use my otoscope and my ophthalmoscope, and I'm going to look in his ears and eyes. Making sure I have my light on, which I do. So I'm going to pull on the ear and pull back, and then I'm going to assess his tympanic membrane. And when assessing, I'm looking for redness, edema, drainage, or any other abnormalities, which he does not have any. And then I would come around to the other side and do the same thing. Just for demonstration purposes, I won't do that, but I would do the same thing bilaterally on both ears to make sure that his internal ear structures are within normal limits. I would also have him follow my light while I have it on to the 6 cardinal gazes, making sure that his neuro is intact, which it is. He's a good patient. He cooperates with me. I would also look at his inside his eyes, looking for the retina and making sure my light's on good. Okay, when I'm looking at the retina, I'm looking for the red retina, and I'm also looking for I'm looking for any kind of abnormalities. I'm looking for bleeding. I'm looking for anything like that that would cause him to have difficulty with his vision. So I've noted that his extraocular movements are good. I've noted that his hearing is good. I've noted that his tympanic membrane's good. I've noted that his nasal is both patent. Oh, let me look at the septum. Make sure there's no deviation noted at all, which there's not. And also nares are pink and moist and within normal limits. Alrighty, moving on with my assessment, I'm going to continue on down to the chest, and I'm going to start by inspecting his respiratory effort and the neck. I'm going to look at the neck, I'm going to look at the trachea, I'm going to look at the mouth. Again, I've already inspected the hard palate, the soft palate, the uvula, the teeth, the gums, all of those things I've already inspected. I did not actually get a chance to check his gag reflex, so I'm going to actually stick your tongue out. If I were going to, I would put it in there and see if he did actually gag, checking his cranial reflex nerve number 10. Okay, so I would check his neck. I am looking for abnormalities. I'm looking for symmetry. I am looking on inspection initially, looking for any nodules or anything that stands out. I'm looking to make sure that the trachea is midline. I'm looking to make sure that the larynx and everything is not sticking out, that I'm not seeing any excessive muscle use or anything right here in this area. I'm looking to see if there's any kind of shift one way or another. And I'm going to palpate, and I'm going to palpate the cervical chain, the mandible chain, and I'm also going to palpate above. I'm going to have him, while I'm standing here, to shrug his shoulders, testing cranial nerves, making sure that they're within normal limits and intact. Okay, I see no abnormalities with the neck. He's neurologically intact from the head all the way down through the neck. I see no jugular vein distension noted. His range of motion on his neck, I'm going to ask you to turn your head this way and turn your head that way. Okay. Any pain with that? And then back, flexion and extension. Okay. Also, if I were to palpate his thyroid, I would palpate it from behind, and I would have palpated it making sure that it is within normal limits. And I cannot actually palpate his thyroid, but he has a pretty thick neck. So if I was able to palpate his thyroid, it would be a pretty large thyroid. Okay, I'm going to go ahead and auscultate for bruits while I'm here on his neck. These would be carotid. I'm going to listen on one side at a time. Obviously, I don't want to occlude the other at the same time. Listen to both of them. I'm going to listen with both sides of the bell and the diaphragm of my stethoscope. Okay. No bruits noted. While I have my stethoscope on, I'm going to go ahead and auscultate the lung fields and the cardiac muscle while I'm here. So for the lung fields, I'm going to have him take a deep breath in. And I'm going to listen in 10 areas anteriorly. Okay, after I've listened to all 10 areas, I would categorize his lung sounds as clear or wheezing or rhonchi or whatever was noted. His is clear right now. And then I would listen to the heart, just tell him to breathe normal. I would start off with the aortic valve also, listening with both diaphragm and bell. So I'm going to start off just listening this way. Aortic, pulmonic, tricuspid, Erb's point, and mitral. Listening to his cardiac, I would find that in the mid-clavicular space around the 5th intercostal, and that would be his point of maximal intensity would be right at the apex of the heart, right down in there. Okay, so while I had all that out and listening, I'm going to go ahead and look at his upper extremities. And when I'm looking at the upper extremities, I am looking at the hands, and I'm looking at the arms, and I'm looking at the shoulders. I'm looking at skin color, I'm looking at skin temperature. I'm making sure the color is correct for his ethnicity. I'm looking and making sure the temperature is appropriate for the room and the situation. I am testing the pulses, so I would check radial pulse, brachial pulse, making sure that they were both present and regular. I would test range of motion in the upper extremities on each joint and each finger, the shoulder and the elbow, testing range of motion with all of those. I would test strength. I would ask him to squeeze my fingers, and I would do these bilaterally on both sides. And then I would ask you to push down against my hand. Okay? Now I'm gonna push down and you push up. Okay? Making sure that he has equal strength bilaterally in both of his upper extremities as well. Also, while I'm here, I would also have noted the skin on the chest, looking for any kind of abnormalities or colors or rashes or lumps or anything that could be abnormal on the chest as well. So I would do both of his extremities bilaterally, looking at all of those things. I would then, while he's sitting up, I would go ahead and move to the back of his chest, and first I'm going to inspect and make sure that there aren't no abnormalities noted on his chest. I'm looking for even skin color. I'm looking for moles or anything that has characteristics with A, B, C, D, or E. I am looking for diaphragmatic excursion. So I'm going to have him take a deep breath with my thumbs together. And I'm going to measure and make sure that it comes in and out equally at the same time, which his does. After I've inspected his back and palpated, I can go ahead and I'm going to percuss all of those same lung fields that we had just talked about. I'm comparing each side too. He has two lungs, and so I'm comparing each side. Anteriorly and posterior, I'm looking to make sure there's no kind of flail chest or anything like that. I want breathing to be symmetric. I want the chest to rise and fall equally at the same time. And while he's here, I am going to go ahead and I'm going to listen to the lung fields. I'm going to listen to all of them. And I'm going to note them again if they're clear or wheezy or bronchi or whatever. Okay. I'm going to auscultate all of these, and I'm going to make sure that I auscultate laterally as well. Okay. And while I'm auscultating, I'm going to have him say 99.
99.
And 99.
99.
Okay. Same thing.
99.
Same thing.
99.
Okay, so I'm going to listen like that. Okay, you can go ahead and lay back. I was checking for bronchophony and echophony. Alright, so his respirations, like I said earlier, are about 16 when we first started our initial assessment. So we are going pretty good with that. Next, I'm going to go ahead and move to his abdomen, and I'm going to inspect the abdomen first. I'm going to do a visual inspection for any rashes, lumps, or abnormalities whatsoever. I'm going to look at the skin. I'm going to look at the temperature of the abdomen. I'm going to look at the size of the abdomen and note if it's distended. I'm going to note if it's just any abnormalities at all. Once that is completed, I am then going to palpate the abdomen lightly first, and I'm going to palpate it and make sure that there's no pain, no discomfort, no complaints of any discomfort when I palpate the abdomen, and I'm going to palpate in all 4 quadrants. Once I get that completed, I am going to palpate deeper, and at that point I'm going to push and I'm going to feel for things that shouldn't be there. Okay, I'll palpate all the way around. I can also percuss the size of the liver, listening for a change. It should be in the lower third here of his abdomen if it's coming past his rib cage. Should not be able to percuss the spleen over in this area. Should not be able to percuss that. If I am able to, then that means that I have an enlarged spleen. Okay, so then I'm going to listen to his bowel sounds. And I'm going to listen to his bowel sounds in all 4 quadrants, and I'm going to listen for at least 5 whole minutes in each quadrant if I don't hear anything. While I'm here listening, I'm going to go ahead and listen for his abdominal aorta. I'm going to listen for bruits for those. And then I'm also going to listen for his renal arteries bilaterally. Okay, and his iliac arteries bilaterally. And then his femoral arteries bilaterally. I would listen bilaterally as well for both of those as well. Okay, after I've completed that, I'm going to move on down to the lower extremities. Same thing with the lower extremities that I did with the upper extremities. Obviously, the patient would not have pants on and socks, but I would look at the patient's skin tone. I would look make sure that the color was consistent with the skin or the patient's ethnicity. I would make sure that there's no heat, especially noted in the calves, or pain or tenderness noted in the calves. I would note range of motion bilaterally in both legs at all joints, so that's hip, knee, and foot and ankle. Obviously, I'd make sure that we could do an abduction and an adduction bilaterally, checking range of motion for both of those. I would note pulses, so your pedal pulses, your post-tibial pulses, which is back behind the foot. I don't know if you can see that on the camera or not, but it's back here. And then your popliteal pulses, which is just behind the knee, right in the back, okay? I'm looking at fat distribution. I'm looking at muscle distribution. I'm looking at neurologically. I'm going to test their strength. So can you push against my hand? Okay, bilaterally. Okay, can you pull against my hand? Okay, bilaterally. I'm going to hold your leg down. I want you to raise it up. Okay, good. This one, same thing. Okay, I'm going to raise your leg up. I want you to pull it down. Okay, same thing. Good, good. So I'm noting that he has range of motion across both legs bilaterally. To test his smell, continuing on with the neurological examination to test his smell, I would have him smell something familiar, like an alcohol swab, and see if he was able to recognize that smell. For sensation, I would use a soft, dull, so the tip of my pen and then the tip for my pen light, and have him tell me if this was a soft sensation or a dull sensation, going back and forth in a few different areas and testing and making sure that he could identify soft and dull. I would go ahead and have him to stand up, and I'm going to make sure that his cervical spine is symmetrical. So I'm going to look at his cervical spine. I'm making sure that it's symmetrical. Have him hold out his arms, making sure that it's symmetrical. Go ahead and bend over and touch your toes for me. Okay, I'm looking, making sure everything's fine in his lumbar spine. Making sure that he can twist this way with his lumbar region and twist that way and make sure there's no pain or anything like that noted. Can you do a squat? Okay. And then also to test his gait, I would have him to ambulate this way and then that way, making sure that he had balance for his gait. You can go ahead and lay back down on the bed. Okay, I think I have looked him over from head to tail the best I can. As far as being male or female, if it was female, I would do a female examination or male examination of the genitalia, and looking for anything abnormal of the genitalia obviously would be noted. If he were female, or if it was a female, I would note things like menses or last menses or menopause, history of female. If he was male, I would note things like prostate surgeries, TURP surgeries, any kind of history of cancer noted for either one of those, anything like that. We would always still continue breast examination, at least visual inspection, male or female, because males do have a chance for breast cancer as well. And I believe that that's going to conclude my head-to-toe assessment. Thank you for watching. I appreciate it.